In this video, we'll be discussing about what is umbilical hernia and why it happens, what are the possible symptoms and complications that can happen. If the muscle is intact, that is normal. But if we have a defect or weakness in the muscle which is protecting the abdomen, then it is referred to as hernia. If it happens at the region of the umbilicus, it is called as umbilical hernia. And if it happens over as a result of a previous open surgery that has happened to the patient, then if it occurs over the incision area, then it is called as incisional hernia. There is another dangerous and dreadful complication called as strangulation, where, as discussed, if this is the hernia ring and this is the intestine, apart from getting blocked from passage of its content, there will be blockage of, or there will be cut off of the blood supply to the intestine also in case of a strangulation. Just like if there is a ring that has been tensely stuck or stuck over the finger, the way this finger gets swollen and edematous, the same thing can happen to the intestines also, resulting in death of the intestine. Are you noticing a soft bulge near the umbilicus or over the abdomen? Especially if that bulge is increasing in size when you are coughing or when you are lifting weights, and the same bulge if it is decreasing in size slightly if you are lying down, then this video is for you. You may think that this is harmless and it's been there for since very long, but don't ignore that because it can cause very dreadful complication. So in this video, we'll be discussing about what is umbilical hernia and why it happens, what are the possible symptoms and complications that can happen, and what are all the treatment options for umbilical hernia. So to start with, what is hernia? Hernia is defined as weakness of the abdominal wall which is protecting all the abdominal organs. That means, for example, if you take the head part, we do have a brain which is surrounded by a bony structure called as skull. If you take for example chest, we have heart and lungs which is being protected by rib cage. Likewise, if you take abdomen, we have multiple organs like liver, gallbladder, spleen, pancreas, small intestine, large intestine, kidneys, uterus, urinary bladder, etc. All these organs don't have a bony protection. The only protection that exists for all these abdominal organs is nothing but the muscle. The thing which we commonly refer to as six-pack is nothing but we burn out all the fat and we bulk up the muscle so that the muscle appears more prominent. If the muscle is intact, that is normal. But if we have a defect or weakness in the muscle which is protecting the abdomen, then it is referred to as hernia. If it happens at the region of the umbilicus, it is called as umbilical hernia. And if it happens over as a result of a previous open surgery that has happened to the patient, then if it occurs over the incision area, then it is called as incisional hernia. So as discussed, hernia is nothing but a weakness of the muscle through which the contents inside the abdomen try to come out whenever we cough or weight lifting is being done. So next discuss about why hernia happens. So to know about this, we need to know what happens exactly when we are inside the mother's womb. What happens when a baby is growing inside the mother's womb? The only connection between the mother and the baby is the umbilical cord, through which all the nutrients will be flowing into the baby. So the baby's musculature is designed in such a way that just imagine the abdominal wall as a normal wall, and for this umbilical cord to enter the abdomen, we have made a small gate so that the umbilical cord will be entering into the abdomen. So once the baby gets delivered, this umbilical cord falls off, and this door through which this umbilical cord has entered remains weakened spot over the abdomen, which stays like that. As the baby grows into an adult, there will be definitely some amount of straining that will be happening whenever the baby is lifting weights or coughing, straining, etc. So as age progresses and the amount of pressure that increases, that is created over the abdominal wall, mounts up, and the small weakness which may or may not exist develops into a proper gap as the age progresses and develops into a proper umbilical hernia. Once if you are noticing any bulge at the umbilical region or over the abdomen, that is due to the intestine or the fat over the intestine trying to come out through the weakened spot in the muscle. This is what happens in a hernia. That is why we are able to appreciate a bulge, and that bulge too increases when we are coughing or straining or lifting weights. And once we lie down, because of the effect of gravity, whatever content that has come out tries to go inside automatically. That is what happens in a general hernia. So if you ask me about the symptoms and complications of hernia, as discussed, the bedside diagnostic tool to diagnose a hernia is whenever the patient coughs or strains and there is increase in size of the bulge, and if that bulge decreases in size on lying down, it must be a hernia. Next, we'll discuss about what are all the possible complications that can happen in a neglected case of hernia. The two main dangerous complications that can happen are obstruction and strangulation. What happens in a case of obstruction? Just assume this as the hole in the muscle and this fingers as the intestines which are protruding out through the hole in the muscle. In initial stages of hernia, whenever the patient coughs or strains, the intestine tries to go out, and once the pressure is relieved, the intestine tries to come back to its original position. In bit advanced features of hernia, then what happens? The intestine tries to go out and it doesn't come back, but still there is no tightness to such extent that obstruction or strangulation happens. But what happens in more advanced cases, the intestine pushes further into the hernia, and thereby the intestine is nothing like but a pipe which transmits the food. If this pipe gets obstructed or occluded because of the tightness of the hernia, then patient may develop into an emergency called as obstruction, where patient may develop fully distended abdomen with vomitings and all. Because what might have happened in such condition is the pipe has got blocked and the pipe is getting overflowed from the starting point, which is mouth. So that's why in case of an obstructed hernia, there will be sudden bloating or full distension of the abdomen along with vomitings for the patient, and he or she won't be able to pass stools at all. There is another dangerous and dreadful complication called as strangulation, where, as discussed, if this is the hernia ring and this is the intestine apart from getting blocked from passage of its content, there will be blockage of, or there will be cut off of the blood supply to the intestine also in case of a strangulation. Just like if there is a ring that has been densely stuck over the finger, the way this finger gets swollen and edematous, the same thing can happen to the intestines also, resulting in death of the intestine. That complication is called as strangulation, which is a die-hard emergency. So to prevent all these complications from happening, what we generally suggest in a hernia case is treat the hernia at the earliest, because stitch in time saves neck.